Welcome to the Dr. Shawn Tierney Podcast. My name is Shawn Tierney, and I am a neuromusculoskeletal synologist. I treat athletes and high performers. My goal with this podcast is to help you make better decisions regarding your health, athleticism, and all aspects of life. Here, I'm both a student and a teacher. Thank you for tuning in. Hey, welcome to the Dr. Shawn Tierney Podcast. This is Dr. Shawn Tierney. I'm here with the most important doctor in my life, Dr. Sandra Goines. So, Sandra, it's so good to finally have you on the podcast. Thank you.
You're welcome.
And I just want to start with, learning how you became who you are. So tell me, how your life started, the first 10 years of your life. How did you learn this is what you wanted to do and be?
Well, from the age of 3, I knew I wanted to be a doctor. Don't know how. I just knew that was my life's path. And many people don't understand that. So it's hard to explain it to people, but that's the truth. So that's what I planned for my life. But leading up my full first 10 years of life, went to school, played like any other kid, and I also developed a love of dance. So around age 10, maybe 11, they actually put me in the wrong PE class at school. I got myself changed to an aerobic dance class, and the class was actually more centered on jazz style of dancing. So I fell in love with that, and to this day, I'm still dancing. So that was probably my first 10 years.
All right. Well, you must have had some illnesses or anything that led you to know you wanted to be a doctor. You just like come out of the womb knowing I'm going to be a doctor.
That's interesting. Well, no, I knew I was going to be a doctor, but by about the age of 4 or 5, I was given an antibiotic that I had a severe allergic reaction to that hospitalized me. And so that further, I think, probably reinforced my idea of what I wanted to do, because someone helped me and I wanted to be able to help someone else.
Yeah. And then fast forward to your life in dance, and you're dancing. You started dancing when you're in 7th grade? What grade?
About 10, 11 years of age.
10, 11 years of age. Wow. Okay. So then, and you were doing that because of the first class you had. Mm-hmm. What kind of dancing did you get involved in?
So I've done many different forms of dance. My favorite is actually still jazz dancing, but I've done ballet, modern, tap, and now I'm actually a competitive ballroom dancer, as well as putting on shows and doing team matches here and there when I get a chance between my long work hours. So I try to create a balance.
Yeah, I think you're doing okay. So then, there must have been something that pulled you into being an osteopath, because you're not just a regular doctor. You're an MD. You're an osteopath, which is in many ways is extraordinary. So what shifted your focus towards osteopathy?
Well, first of all, let me explain osteopathy, because there's still a lot of people out there that don't know. I always tell people we're kind of a hybrid between an MD and a chiropractor, because we are trained, taught, in medicine and surgery, but we're also trained and taught in body work and how to create alignment in the body and allow movement to happen more naturally so you can prevent injuries. And I mean, it's just a giant field, and I get the best of both worlds by being an osteopath.
Now, what was your inspiration? How did you decide you wanted to move that direction?
So I was only aware of MDs my whole life. And I was in a car accident, believe it was my first, maybe second year of college. I was in a pretty severe car accident, and where I was just in constant pain. I had to drop out of school that semester, and I felt like I had constant headaches. It felt like someone was stabbing me in the back with a knife constantly. It was just horrible. And I was referred by someone, I'm not sure who at this point, it was so long ago, to an osteopath. and she worked on me using the hands-on methods of treatment that were learned in school. And she immediately got rid of my pain. So that really, really interested me. And I knew that I wanted to learn how to do that so I could help other people. So at that point, I kind of just threw out all of my MD catalogs and said, I'm going to osteopathic school.
That's great. And it's such a game changer for me. I mean, going to know you first as a chiropractor and understanding that the osteopathy that you did, I was amazed with some of the things that were as a chiropractor would take us a lot of work to solve a problem, but then you would come in with your osteopathic myofascial release, your craniosacral, and trauma would be solved in one treatment. I thought that was amazing. It's like there's so much thought and talent in there, and I think that one of the things that I picked up on from you is that you just have this real, true sense of yourself and the other person, and you can kind of work with the other person in the most gentle way. I almost think it's like the ultimate communication where you're helping that person move the way that they want to move. So it's you're expanding somebody's freedom. It's like, hey, the body is trying to move this way. And you're like, oh, I want to help you go that way. You drive by trying to move this way, you kind of help the body go that way. And next thing you know, their body kind of unwinds the tension and they're better. And you know what? It sometimes doesn't come back. The problem doesn't come back. So it's kind of amazing.
It's incredible. And some of the modalities that we employ are so gentle and minimal, not much force involved. Yeah, and people will think, well, why did I see you? You didn't do anything to me. Right. But then I'll hear the next day that they've obtained great relief from the treatment that we'd accomplished.
It's amazingly powerful to affect, really, I guess a big part of the osteopathic practice is like fascia, right? I mean, you're trying to balance out the fascial motions, the natural motions, correct? Is that
exactly? If you can imagine, and how we're taught to think about it is that if your fascia is a onesie that you put on, so that any movement, I mean, even including your head, you got to have a hoodie on that onesie, but once you start moving one part of the body, it affects the fascia in other parts as well. So by doing, when I do osteopathic work, I do specialize in craniosacral and myofascial release. But when you start working on one part of the body, it just really starts, as you were alluding to, it releases the other parts of the body as you move down.
Right.
And that's the way I like to treat. I like to start at the head, cranial work, and work myself down using a combination of those modalities to just unwind everything, get everything lined up. And sometimes when you work on somebody, it doesn't unwind immediately, but it will over the next 24 hours and actually align in the right space where it's supposed to be.
Yeah.
And so it creates for much better biomechanics, especially if you're working on biomechanics, proper biomechanics at the same time. It just all works together beautifully and people feel much better.
It's kind of a global treatment. It's almost like, when you get work done by you, it's almost like, hey, kind of it's like being touched by an angel. It's like, I'm not being pushed. I'm not being pulled, just this very gentle, but confident, treatment. So there's just this gentle wisdom that comes through. And it's like you're accepting the person's body and helping them move where it wants to. You're kind of bypassing their cognitive, thinking process.
And you are working on an energetic level as well. You're entering each other's electromagnetic fields, which, is commonly taught in physics, that we have biomagnetic fields. So we kind of entwine our energetic fields. And so I can a lot of times feel what the other patient is feeling and know I need to work on that part of the body. So it is very interesting once you start practicing more.
Yeah. Well, you get, you've gained a knowledge that's almost like an intuition, or maybe it is an intuition to understand, comprehensively what's really happening. And I think that's knowing you part of what your personality is you have this, I just know that this is what it is. I'm like, well, what's the reason? Well, here's the clinical reason, here's the mechanical reason, here's the chemical reason. But I kind of know, but I could be wrong. I think you have this anomalous, maybe I'm wrong, but this is what it looks like. Let's just look in this direction and move forward. So I think it's been really, a blessing to see how to work with somebody. And it's like, in a sense of how relationships, should function in the best way. Because you come at somebody and you see them in earnest without judgment, and you look at them and you help them go where they want to go. It's like, oh, you want to go here? Let me help you go where you want to go. Now you need to go over here. This is the process that people go through. And you're just kind of assisting them. It's a very beautiful way. It's like you're enhancing their freedom, and that's, and I think in everything you do, it's in the osteopathic work. There's a lot of the, general medical side, so you have this beautiful kind of peace about you and understanding and openness that I see. But I think there's a lot more to osteopathic education. I mean, you pretty much had the education that the medical doctor had, with the addition of this kind of orthopedic musculoskeletal education, and then you took that and you went through a regular residency where you were doing a lot of things, whether you were doing gynecology and fashion, and surgery and derm and pediatrics, and it was quite extensive. And you did that. Where did you do your residency now? What was that?
I did it through Downey Regional Medical Center, which I believe now is called Presbyterian Hospital in Downey. But doing that particular residency, it was an osteopathic residency, which is what I wanted. Many of the residencies in the state of California are allopathic, or for MDs, medical doctors. And I wanted to stick to my osteopathic roots and continue learning more about that. So we had the opportunity working through Downey. I worked at UCLA. I spent a month working on Catalina Island as my rural medicine rotation, which is kind of funny, but that's another story. UC Irvine, Miller Children's Hospital, Long Beach Community Hospital, Long Beach Memorial. I mean, I had so many opportunities and so many different settings to learn and to work from and learn from the most amazing doctors in different fields and different hospitals.
I think it's really interesting just, watching. I think you've been a very humble and respected physician. And so much so that, you had, some of the doctors that you worked with in your rounds or in residency, correct? Mm-hmm. When you were at offices, one of the most outstanding doctors wanted to become partners with you, and another outstanding doctor, ended up giving his practice to you, which is kind of amazing. Just like you're just like, hey, this is the person of all of the students that I've seen, all the students that have passed through my office. This is the person, this is the doctor that I'm going to want my office to be passed on to. So, I mean, that's an incredible thing.
Everything just kind of fell into place.
Yeah. I think it's that being very present and very accepting of other people, but also being willing to expand their freedom, like that osteopathic style, like I'm helping somebody be who they want to be. I'm not, kind of the chiropractic style it's good, and you're kind of pushing through their stuck places, which I think is very, very useful, and it's very, very powerful. And osteopaths do that as well. But then you have this other side where I'm recognizing where you're kind of stuck, but you're just trying to get out of it. So you're helping people get through this thing that there's this place where they're stuck, which is a beautiful thing, and it's nuanced. But then there you go. You're ending up at being the only doctor that's on call on Catalina Island for a whole month, and that couldn't have been easy either, right?
No, that was since then they have incorporated laws where residents aren't allowed to work that many hours. But back then, when it was my turn, I got 3 hours off a day and was on call on Catalina Island. The hospital, medical clinic, nursing home, everything was housed in one building. So we pretty much did everything there. There were only 2 attending physicians who took turns week by week that we worked with, but we were the ones on call first up to bat.
Yeah. And you saw a lot of difficult things there.
It was very difficult.
I remember that was probably the most
emotional month for all of us, I think, who rotated through there.
Yeah, so that seemed like the most challenging aspect of the residency. Maybe overly challenging, right? I mean, just a little bit too much.
There's a lot of challenge. But.
Yeah, there's a lot of challenge. And I think that, your critical thinking is challenging. You have to, grand rounds, you have to talk to people, so you have to be very careful with what you say, and you have to present things clearly. So there's a lot of critical thinking that's insisted on in residency, and a lot of times it continues on, and sometimes it doesn't. I think you're one of those doctors that got through residency and decided, hey, there's still so much more, right?
Mm-hmm, definitely.
So tell me about. You got interested in a little bit of like A2M, which is a regenerative anti-aging side of medicine, at really kind of early in your career. So what did that mean to you? How were you drawn there, and what did you get out of it?
Well, I was actually, it was probably my second year in practice. I was cross-covering for another doctor, and her patient that I saw asked me if I prescribed bioidentical hormones. I had never heard of such a thing before. I said, "What's that?" And I started going out, reading books, doing research, and learned about them, which I'll do a separate podcast to explain about those, because it can be a very big topic if you get into it. So I started taking classes on bioidentical hormones and anti-aging and supplements and different testing that you can do from the norm. And I just started getting more tools from my toolbox so that I could be a better diagnostician and a better doctor to treat.
Yeah. So you did kind of a lot of this anti-aging medicine workshop and testing. And then you also did some work, I think, with thyroid especially, that not many people do. Is that correct?
Yeah, I did work with Dr. Wilson, who is famous for creating a protocol where you can actually get people off of their thyroid supplementation.
That's pretty amazing extra step, and that was quite an extensive thing to do, I recall. So let's go ahead and let's now you're practicing. You're in family practice since on your own, kind of.
I've been in private practice since 2004.
2004.
I graduated med school in 2001, so. I've been in practice for quite a while, and I've run the gamut, I think. Originally, I had planned to be an OBGYN doctor, but circumstances just brought me around, like I said, to family practice at Downey Regional Medical Center. And so I accepted that challenge and just went with it. And it was probably one of the smartest things I've ever had to do or did. Because it's opened the door for me to practice all of these types of medicines that I've studied over the years.
Yeah.
And now working with you, doing regenerative medicine since about 2009-ish. That's a whole nother exciting frontier that, we're still pushing ahead. We're learning more about, learning how to treat. And of course, using the high resolution ultrasound just helps so much more, working with you, being the diagnostician, being the expert in that field of medicine, and me in your footsteps, reading ultrasound, but I let you diagnose, because you're the master expert, in my opinion.
Yeah. Well, we have a good team. It's like you have a lot of experience. So we've been doing this for a long time. So
yes.
I think
And, so I'm the medical surgical side of the team, and I get to inject regenerative substances and into the right spot where there's injury or nerve entrapment, and people get better. Sometimes, it requires more than one treatment, but, if we keep working on it, we can actually, a lot of times, prevent surgery, which patients are very grateful for.
Yeah. And I think the big thing that kind of the full circle is, it's like you started working on fascia. You got really good on fascia with your hands, but you still are really good on working on fascia with the myofascial cranial work. But now we're, still working on fascia. We're doing something that's a little bit more, maybe more precise, maybe more lasting, maybe a little bit more invasive, but we're just kind of decompressing nerves, doing a myofascial separation. And it goes right back to like, hey, all that stuff that we used to work with just with our hands, now we're making a change that can last a lifetime in a very short period of time.
With a needle.
Yeah. With being in the ultrasound and you with a needle, we are the team.
Slightly more invasive, but a lot more effective.
Yeah. So we can work together and solve some really big issues. And it's just been a super big honor to do that. I couldn't do it without you. And
nor could I.
Yeah. So I think we're a really good team in that respect. And let's go over some cases. Like what when we started doing ultrasound and we started doing regenerative solutions, what was the first case that stood out to you? Like, hey, this is amazing. This is really outstanding work. What made you? What made the first big impact on you?
I think the first big major impact was working with patients doing stellate ganglion blocks.
Stellate ganglion blocks,
which not many people do.
Yeah.
And I started noticing correlations between people who needed these stellate blocks, but they also needed what we call hydrodissection, which I know you've talked about in earlier podcasts. But they needed a hydrodissection up high in what we call the first costotransverse joint, which is up in here.
Right.
And all those nerves are related. And so doing those treatments really helped the people. And before, that correlation, I don't believe had been noted. So that was exciting for me to be able to make that discovery. Right. There have been so many cases. There was one gentleman that we saw who had had a stroke. First time we had been treating his brother, and he lived in Washington but flew down for treatment, and he came in the office in a wheelchair. And I'm sure you remember this case. We treated him with a few different modalities, and the next day he came in for treatment. He was able to walk on crutches without the wheelchair. So that was very impressive to me. I mean, it's just incredible.
Yeah.
If that were me, I just would be jumping for joy if I could jump.
Yeah.
Other things that have been really useful too is one of my favorite things when I studied osteopathy and was learning those modalities is that, we have 3 diaphragms in our bodies. People do not realize. They think of, our thoracic diaphragm, which separates our lung from our abdominal cavities. But we also have a pelvic diaphragm, and we have the tentorium in our craniums. And so when we breathe, all of those should be moving together as one. They're all muscular units, and they should be moving as one. And a lot of times, one side could get paralyzed or sluggish. And so, of course, I have the tools to treat them manually, as I was taught in school, but we're also able, we've been able to start noticing a lot of patterns in people who have had, say, for example, just the thoracic diaphragm. And the thoracic diaphragm is, people kind of get amazed by it. I don't know, for lack of a better word, but the diaphragm is actually controlled by nerves in our neck. See 2, 3, and 4.
Right.
2, 3, and 4 keeps the diaphragm alive.
Diaphragm alive.
Three, 4, 5. Sorry.
3, 4, 5 keeps the diaphragm alive. Yeah, you got it.
C3, 4, 5 keeps the diaphragm alive. So we've noticed patients will be sore or have spurs, arthritis, different things going on in their neck that can actually be the instigator for having the diaphragm to be off balance.
Right.
So we can actually work on those nerves in the neck and get the diaphragm even.
Right.
But another thing the diaphragm can do is cause back pain, because, and a scoliosis also, because you don't have both sides moving together like this. One could be like this, so that's going to torque your back and cause misalignment and pain and, who knows what other symptoms. So working on that is super amazing and helpful.
Oh yeah, and it's kind of an osteopathic line of thinking too. You think about it, it's like your diaphragm, and then we also have, like, we do this C1 plexus cranial nerve hydrate section. I think that affects the tentorium too.
Mm-hmm.
And then we do the sacral hydrate sections that affect the pelvic floor. So it seems like we're back to osteopathic, principles all of a sudden, right?
Yeah.
We're getting everything to work. So yeah, it's nice to be able to work with you. I mean, you're so accurate with the needle and you're so right on. And I think you just come in and you're just very, very present, very, very current with every patient, very, very gentle, very, very understanding. And,
I try to be.
And I think that it's been a great journey. And I think we made a lot of changes for a lot of people. And I think we've developed new treatments. I mean, there's not a lot of practices that are really working on diaphragms and really associating, the pelvic floor, C1, the tentorium to function. But that's really like you think about your big, fascial pump, your lymphatic pump is really these three basic motions. And then without those, you lose your stability, your core stability, you lose your lymphatic flow, you're just vulnerable. And it's kind of funny to me that I have all these people, and I know you're in functional medicine to some extent too, all these functional medicine doctors that we work with. And I say to them, well, functional medicine is a lot of they're concerned about is chronic infections. It's one of the things that's being addressed. And I think, well, I understand you're dealing with the chemical part of it, but what about the biomechanical part? Because your big lymphatic pump is your pelvic floor, your thoracic diaphragm, and your tentorium. So that's probably important to keep those working, right? Because that's your immune, that's the mechanical aspect of your immune system. And, osteopaths, I think more than any other physician, really have come to respect that. For whatever reason, a lot of osteopaths do regenerative medicine, but you're the only one that's really figured out, hey, we're gonna work on these diaphragms. And I'm like, you show this to me, I'm like, yeah, we've started doing it. And it's like everybody, because I teach this other places, a lot of other practices are benefiting from you saying, hey, how do we get these diaphragms to work better? And I think it's made a big change in our practice and a lot of other practices too. And not as many as we would like. Right. But I think that, you're making a big change by hey, we're applying these principles that have been with you for a long time since your car accident now to your, life working with regenerative medicine and decompressing nerves and enhancing function and things. It's nice because a lot of times when we do these things, it seems like we don't have to keep going back and doing them again. It's like we do them and then it's like, well, that's kind of done. What's next? So we're just kind of moving through
sometimes people will have a major pain that solves it and that pain goes away. And then they start to realize they have a pain somewhere else that we need to look at.
I think a lot of what we see too is we have this ability with regenerative medicine to get a healthy person to heal. And it's like nice we have all these professional athletes that we deal with, and
yes,
young healthy athletes that we deal with, and a lot of regular people too. But when we go through all this diagnostic with Dr. Padley, with radiology and the ultrasound imaging with me, and then you doing these procedures, I think we're putting together a good team, but we're also finding where we missed, and I think we're constantly getting better at seeing these missed places. And I think one of those things that really comes up is, like you were saying, with C1. So with the first costic transverse hydrodissecting over that, where we have those spinal accessory dorsal scapular nerves. And I think that part of that is that when we do a stellate block, we're affecting the autonomic system, the vasodilation, vasoconstriction. And I think, that spinal accessory nerve has a lot of autonomic innervation. And that's probably why they have this SCM, cervical plexus and trapezius pain, that goes away when we do a stellate block, because we correct the autonomic system. And then all this muscle pain goes away when we didn't even address those muscles or the nerves directly to those muscles. So we're seeing some big changes. So for you as a patient, did you ever have like a nerve impingement in your arm or any place else that made a big difference? That was surprising to you, or?
Well, speaking of my arm, there was a time I thought I broke it during one of my exercise classes, and I walked around for 2 weeks just really absolutely believing I broke it. I had so much pain. I even had an x-ray done. There was no break, but turned out it was at a place of a common nerve impingement in the arm, where two nerves cross over each other and will cause an impingement and pain. And so, of course, we hydrodissected that, and that pain it instantly went away and has not returned. And this has been years and years ago. Yeah. It was amazing. Absolutely amazing what sometimes you think you might have, and it turns out to be something else. Yeah.
And that's just saline.
Saline. Yes. Dehydrodissection with saline. A little bit of lidocaine since we're working around the nerves to make it comfortable. But saline.
Yeah. So that was amazing.
Saline and a needle.
And that's what we see all the time is like, where's the problem? Let's be comprehensive. Let's hydrodissect the right area and then get a real solution. So now you've been in practice for now, 30 years, 32 years almost, 31 years, I guess, right?
22
years.
Coming up.
22 years, okay. I
believe.
So 22 years. And you're still able to keep your dance practice going. You're still able to practice.
I'm trying.
And so what do you look forward to over the next 20 years of practice? I mean, you're going to keep dancing, obviously.
Yeah, I can't seem to quit. So I will probably keep performing and competing, because that's what helps relax my mind. That's my hobby. That's what I enjoy. I love the movement. I'm not a person, I can't sit still. So it's an ideal hobby for me. And hopefully, regenerative medicine is just going to advance more and more, and hopefully we'll be a part of that and get to help as many people as we can.
Well, it sure has been an honor working with you.
It's an honor working with you too. Thank you for allowing me to.
Yeah, every part of the life, right? So we got it. All right. Well, thank you so much. And so how are we going to get a hold of Pacific Healing and Wellness and you?
Probably the best thing, if you want to contact my practice, our number is 562-431-5010. It's called Pacific Healing and Wellness. For regenerative procedures specifically, we have a scheduler. Her name is Kelly. And what is her phone number?
562-668-2196.
And I think those are the best ways, just to make a call to get a hold of us.
Great. Awesome. Thank you very much. Good first go. I'll see you in a second.
Okay.